This is Dr. James, and today we're going to talk about a common thing that happens with a newborn called nasolacrimal stenosis, or a blocked tear duct. Really, babies don't have tears where when they cry, tears come out until usually about 2 months old. So if you have a baby that their eye is constantly tearing, and then when they go to sleep, it mats shut, that's a blocked tear duct, and they're very common. I usually see probably 1 or 2 a day. And they last for a while. So most of them, I would say the biggest chunk of the pie go away between the time they're 2 to 4 months old. But we really don't worry about it until they're 9 months old. If they're 9 months old and it still hasn't gone away, that's typically when we do a referral to an ophthalmologist. Now, when the ophthalmologists see them, of course, they'll examine them, and usually they'll put them on an antibiotic ointment or drop for a period of like 5 to 7 days to see if it goes away. It hardly ever goes away. And then when they follow them up, then they've proven to the insurance company that this wasn't just discharged from an infection, and then they'll do the surgery. Now, for the most part, the surgery is kind of a surgery in name only. The babies do have to be put asleep. But the surgery is usually a wire probe that's ran through the tear duct to open it up. There's usually not any cutting involved. Now, every once in a while, this does not do the job, and they have to surgically insert a stent to hold this open. This is something that in my career I've maybe had a couple of times. But to be honest, the whole procedure is fairly rare in my career. I may have maybe 1 a year that has to have this done, and I would say it's probably even less than that because almost all of them go away. Now, when you look at this online or people's advice, you're going to get several things. You'll get people that recommend that you take a warm, soft washcloth and rub on the inside corner of the eye, pushing against the nose, rubbing in a circular motion, doing that for maybe 15, 30 seconds at a time, and doing that 2 or 3 times a day. The thought is, by massaging the tear duct, it'll open it up. Does it work? I don't know. I've recommended it. I'm not sure it's not recommended just to give you something to do so you feel like you're helping and then it go away on its own at the normal time, but it's definitely not going to hurt. I've also heard of people putting breast milk in their eye. Does that help? Again, it doesn't hurt. I don't think it probably does anything. I think probably Mother Nature and time take care of this the majority of the time, and anything that we're doing is probably just making us feel better. Now, when we do have all these tears, it does make it a little more likely to get infected. So if all of a sudden you have a blocked tear duct, and then you have a sudden change where there's a lot more drainage, and instead of it, the normal you're going to see is clear tears during the day, and then after they sleep, matted shut with some mucus that might be colored. If you see that change where instead of the clear tears during the day, it's always a colored discharge that's coming out constantly, or the eye is bright red, or you see any swelling of the eyelids, that's when you want to go, hey, this is a change. Let's go back and see the doctor and make sure that we don't have conjunctivitis, otherwise known as pink eye. So again, blocked tear ducts, very common. They usually go away on their own. There's usually not a lot you have to do, and we don't usually worry until 9 months. The biggest chunk of the pie of them go away between the time they're 2 and 4 months old. Hope this helps.